On the 27th of May, the government, through Ministry of Health, announced the closure of Uganda's border with the Democratic Republic of Congo.
Uganda is temporarily closing the border with the Democratic Republic of Congo with immediate effect.
This followed a continued escalation of the Ebola virus disease outbreak in neighboring DRC. The border closure came after government had initially suspended flights to DR Congo, cross-border trade and public transport. Only cargo transport, humanitarian operations and the movement of health and security personnel were allowed to continue.
Uganda was declared Ebola-free on the 28th of July. However, we know that in the DRC, Ebola is still raging, and so we need to be vigilant and to make sure that Ebola does not come back to Uganda.
But while the former border has remained closed, concerns have grown over the use of porous crossing points along the Uganda-DR Congo border,
where people cross without going through migration. So all these provide a risk where countries must collaborate in order to jointly address.
Of course, people will try to use the porous areas to access Uganda. We want to put in mechanisms, especially to sensitize the border communities, so that they'll be watching out for people's movements, be able to interrogate and assess the risks. Fortunately for Uganda, we have community structures, we have the village health team members, we have the queues for those that have recruited some. And it is those structures that are going to be now mobilizing the communities where they are regarding the presence of the possibility of high-risk people moving across borders.
Uganda's Ebola Incident Commander, Dr. Atek Kajirita, says the challenge can be addressed by working closely with communities living along the border line.
It is they come to the communities. Okay, there was somebody sneaking in to come to his family. So if the family can report that he's from Congo, they are not allowed, there is a problem, he will not come. Or if he comes, he will be reported, and we can pick them through our surveillance and screen them, quarantine them, and that way we have early detection. So the answer is within communities, and some lead to enforcement and ensuring that people are heavily sensitized.
He says providing essential services on the DR Congo side could also help reduce the need for people to use informal crossing points.
Because sometimes maybe sneaking in to rush and look for where to get some services. So if we are going to set 4 strong treatment centers in DRC, so if it is really a health-related issue, then they should be able to go to those treatment centers and get the services as quickly as possible.
We have set up treatment centers and the laboratories in the DRC to handle cases and support our neighbors.
Dr. Atek says the standard operating procedures are also being revised to take into account the need of communities that depend on cross-border movement, including traders, medical travelers, and school-going children.
We are making efforts as a country, as Uganda, to really see how we can lessen on the restrictiveness of that border arrangement. So far, we are looking at expanding our essential travelers docket. We are going to include the schools, or school children, they should be able to cross. We are also including the medical tourism, those who have really referrals, those who have really cases that need attention in Kampala or in Uganda. Those will be included, humanitarian workers will be included, security will be included. We're also looking at the issue of traders.
We are going to continue with enhanced surveillance, especially at the borders. We are going to continue tracking truck drivers because we know they come from high-risk areas in the Congo. They transit Uganda, go to Kenya, Tanzania, and South Sudan. Others come to Uganda. So we should track these people in case of any alert, we can locate them from wherever they are.
I'm Benjamin Jumbe, NTV Weekend Edition.